I am Dr. K. Amuda from Biochemistry Department. In today's topic, we can see what is thrombocytopenia and about porphyria. The thrombocytopenia is a low number of platelets than the normal. So, when the level is less than 1,50,000 platelets per ml in the blood, this thrombocytopenia, it may be either inherited or else it may be acquired when condition occurs, such as the use of certain drugs. When it comes for the classification of thrombocytopenia, it is classified into three groups. Coming on for the first one, it is diminished production, and this is caused by viral infection, vitamin deficiencies, aplastic anemia, and also due to drug induced. And the second by increased destruction. The destruction can be done by some of the drugs, heparin, and this is idiopathic, during pregnancy, and also due to immune system. And the third classified is sequestration, and this is caused by enlarged spleen, neonatal, during gestational, and also during pregnancy. So when you want to see the symptoms of thrombocytopenia, this includes pitachi, that is superficial tiny areas of bleeding into the skin resulting in small reddish spots. Next is fatigue, purpura, that is easy or excessive bruising is called as. Then prolonged bleeding cuts, spontaneous bleeding from the gums or nose during jaundice, heavy menstrual bleeding than the normal, blood in the urine or even in the stools, during enlarged spleen, that is called as a splenomegaly, and also due to DVT, that is deep vein thrombosis. Decreased platelet production. Aplastic anemia is a general term used when the bone marrow fails to produce any blood cells, that is red cells, white cells, and platelets. This can be caused by some viral infections. The viral infections affecting the bone marrow, for example, rubella virus, mumps, chickenpox, it may be also due to hepatitis C and HIV also. And here, during chemotherapy, drugs frequently cause bone marrow suppression. And not only chemotherapy, some drugs other than chemotherapy can suppress platelet production. I can give the example for the drugs such as thiazide diuretes. Then cancers of the bone marrow and blood, that is leukemia, or cancers of the lymph nodes, that is lymphoma, can cause vigorous degree of thrombocytopenia. And also due to cancers from other organs, sometimes invade the bone marrow and result in impaired production of the platelets. And this is also caused due to long-term alcohol can cause direct toxicity of the bone marrow. And this may also be caused due to deficiency of vitamin B12 and folic acid, can result in low platelet production by the bone marrow. Increased platelet destruction or consumption. This is a second cause. Increased platelet destruction or consumption can be seen in a number of medical conditions. They may be divided into immune related and non-immune related causes. Many medications can cause low platelet count by causing immunological reactions against the platelets called drug-induced thrombocytopenia. Some examples may include sulfonamide antibiotics like digoxin, quinine, quinidine, acetaminophen, and rifampin. Heparin is a commonly used blood thinner, can occasionally induce an immune response against the platelets resulting in the rapid and severe destruction of the platelets. This condition is termed heparin-induced thrombocytopenia, or we can say this also as HIT, idiopathic thrombocytopenia purpura, that is shortly as ITP. It is a condition where the immune system attacks the platelets. In severe condition, the idiopathic thrombocytopenia purpura can result in very low platelet counts. In adults, this is often a chronic in the sense it is a long-standing condition, whereas in children, it can be caused actually after a viral infection. Transfusion of blood products and organ transplantation can sometimes cause immunological disturbance resulting in thrombocytopenia. The next is thrombotic thrombocytopenia purpura. It is as TTP, and hemolytic uremic syndrome. And they are related conditions that can cause non-immune consumptive thrombocytopenia resulting from some infection bacteria. And the next one is injury to or inflammation of blood cells, and sometimes artificial heart valves can cause increased destruction of the platelets. It causes splenic sequestration, and this can lead to low platelet counts as a result of enlargement or change in the function of the spleen for a variety of reasons. When the spleen enlarges, it can retain more than the normal amount of the platelets. This is one reason. And then the common causes of thrombocytopenia due to this cause is enlargement may include advanced viral disease with portal hypertension and also due to blood cancers. Next we will see how it is tested and diagnosed. So coming on for the test, we go for blood test. A complete blood count determines the number of blood cells including platelets in a sample of the blood. In adults, normal platelet count is 1,50,000 to 4,50,000 platelets per microliter of blood. If the complete blood counts finds fewer than 1,50,000 platelets, it is thrombocytopenia. So then we can also go for physical examination including a complete medical history. So physical examination in the sense when there is bleeding under the skin and feel the abdomen to see if the spleen is enlarged. And the illness you have had and the types of medications and supplements you have already taken. Then coming on for the complications of thrombocytopenia. The complications of thrombocytopenia may be excessive bleeding after a cut or an injury resulting in hemorrhage and major blood loss. However, spontaneous bleeding due to thrombocytopenia is uncommon. So unless the platelet count is less than 10,000. Prevention of thrombocytopenia. In general, thrombocytopenia can be prevented if the cause is known, and it is of course preventable. So for example, if a certain medication is found to induce a low platelet count in an individual, then its future use needs to be avoided. Then alcohol avoidance should be encouraged in people with the known alcohol-induced thrombocytopenia. Next is current and future use of all heparin products must be avoided in people diagnosed with heparin-induced thrombocytopenia. Treatments for thrombocytopenia. People with mild thrombocytopenia may not need treatment. For example, they may not have symptoms or the condition clears up on its own. Some people develop severe or long-term thrombocytopenia, that is a chronic condition. So depending on what's causing the low blood platelet count, treatments may include. So going on for the treatment, treating the underlying cause of thrombocytopenia, the doctor can identify a condition which causes a thrombocytopenia, then addressing that cause may clear up the thrombocytopenia. So we can take an example. In heparin-induced thrombocytopenia, doctor will direct to stop using heparin and prescribe a different blood thinning drug. The thrombocytopenia may persist for a week or more despite stopping all heparin therapy. The next is blood or platelet transfusion. If the platelet level becomes too low, the doctor can replace lost blood with the transfusions of packed red blood cells or platelets. The next treatment is medications. In immune system problem, the doctor may prescribe drugs to boost the platelet count. The first choice drug may be a corticosteroids. If that does not work, he or she may try stronger medications to suppress the immune system. The next treatment is plasma exchange. Thrombotic thrombopenic purpura can result in a medical emergency requiring plasma exchange. The last one, we can go for surgery. If the treatment options does not help, the doctor may recommend surgery to remove the spleen. Porphyrias. So porphyrias are the group of rare inherited blood disorders. People with these disorders have problems making a substance called heme in their bodies. So heme is made of body chemicals called porphyrin, which is bound to iron. Heme is a component of the hemoglobin, a protein in the red blood cells that carries oxygen. It helps red blood cells to carry oxygen and gives them their red color. Heme is also found in myoglobin, a protein in the heart and skeletal muscle. The body goes through several steps to make heme. In people with porphyria, the body lacks certain enzymes needed to complete this process. This causes porphyrin to accumulate in tissues in the blood. This may cause a variety of symptoms ranging from mild to severe. The most common symptoms of porphyria are abdominal pain, light sensitivity, and problems with the muscles and nervous system. The symptoms of porphyria vary and depend on which enzyme is missing. We'll see the causes of porphyria. This porphyria, it is a genetic disease. According to the National Institute of Health, most types of porphyria are inherited from an abnormal gene called a gene mutation from one parent. However, certain factors may trigger symptoms of porphyria known as attacks. These factors include use of certain medications, use of hormones such as estrogen, alcohol usage, smoking, during infection, exposure to sunlight, and when we are in a stress, during dieting and also during fasting. So when come for the types of porphyria, there are several types of porphyria which are classified into two categories. One is hepatic and another one is erythropoietic. Hepatic forms of the disorder are caused by problems in the liver. They are associated with symptoms such as abdominal pain and problems with the central nervous system. So coming on for the second classification, it is erythropoietic. Erythropoietic forms are caused by problems in the red blood cells. They are associated with light sensitivity. We'll see the symptoms of porphyria. Symptoms depend upon the type of porphyria. Severe abdominal pain is present in all types, that is in two types, as well as urine that is a reddish brown in color. This is caused by the buildup of porphyrins and typically occurs after an attack. The symptoms associated with hepatic disease includes limb pain, neuropathy, hypertension, fast heartbeat, and also due to electrolyte imbalance. The symptoms associated with erythropoietic disease includes extreme skin sensitivity to light, anemia, changes in the skin pigmentation, and erratic behavior related to sun exposure. Next will come for the diagnosis of porphyria. Many tests can help the diagnosis for this condition. Tests that look for physical problems includes CT scan, chest X-ray, echocardiogram, etc. Test for blood problem includes urine test for fluorescence, PBG urine test, then complete blood count. Next will come for treatment. There is no cure for porphyria. Treatment focuses on managing symptoms. Most cases are treated with medications. So coming on for the treatments for hepatic disease includes beta blockers to manage the blood pressure, high carbohydrate diet to aid recovery, pain management, and hemetin to shorten attacks. The treatments for erythropoietic disease includes iron supplements for anemia, blood transfusion, and bone marrow transplant. So coming on for the prevention, porphyria cannot be prevented. However, symptoms can be reduced by avoiding or eliminating triggers. The factors that should be eliminated include drugs, mental stress, excessive drinking, certain antibiotics. Preventing erythropoietic symptoms focuses on reducing light exposure by staying out of bright sunlight, wearing long sleeves, hats and other protective clothing while going outside, and asking for protection during surgery. So when you see the complications for porphyria, the porphyria is incurable and difficult to manage. The complications are common. They include coma, gallstones, paralysis, respiratory failure, skin scarring, liver disease, and failure of the liver. In this topic, we have seen what is porphyria and what is thrombocytopenia, its classification, its types, then how it is caused, its diagnosis, and how it is treated. Thank you.